A 20-year-old male patient presents 5 months after a right lower leg trauma that results in an amputation. Initially managed with a skin graft, the patient experienced persistent difficulty with the prosthetic fitting due to the lack of soft tissue coverage, leading to discomfort and pain at bony prominence. Angiography revealed compromised ipsilateral popliteal vessels. So the problem list we have a 20-year-old male patient with right lower leg amputation with exposed tibial bone. Lack of soft tissue coverage has led to the failed prosthetic fit. Compromised vascularity in the popliteal vessels. Difficult bearing weight and discomfort at bony prominence. And finally, need for an alternative reconstruction and rehabilitation to ensure functional prosthetic use. So how will you face the case? Which is the best option for reconstruction for this patient? Option A, pedicle gastrocnemius flap. Option B, free anterolateral dyke flap. The votes are in and you choose option B, free anterolateral dyke flap.
In this particular case under discussion, the correct option for reconstructing the soft tissue defect of the right lower leg after traumatic amputation was a free anterolateral thigh flap. This was chosen due to its excellent soft tissue coverage, minimal donor side morbidity, and its ability to withstand the stresses of prosthetic use. Now, as a reconstructive surgeon, my approach to this case would have been similar to the authors. The ALT flap offers substantial coverage for the defects of this size, and in a young patient like this, it is important to ensure durable, long-term function, especially with the complications of compromised vascularity. Microsurgical anastomosis to the popliteal stumps, as is done here, was a critical step to ensure sufficient blood flow to the flap and prevent further complications. Additionally, personally, I would have also ensured an aggressive rehabilitation program to condition the tissue for prosthetic use. Now, this case report from PRS Global Open highlights the complexity of managing traumatic lower limb amputation, especially in young patients who rely heavily on prosthetics for mobility and quality of life. In this case, the authors did a fantastic job detailing the challenges from vascular compromise to prosthetic difficulties, and how their choice of a free ALT flap helped the patient return to a high level of function. As is seen at the 5-year follow-up, the flap remained stable and the patient was able to comfortably use his prosthesis for extended periods up to 40 hours weekly with long periods of standing. This showcases how innovative reconstructive plastic surgery can have life-changing effects on patients. For more interesting and educational case reports like this one, be sure to visit prsglobalopen.com. Thanks for watching, and we'll see you next time on the PRS Global Open's Face the Case.